So for today's event, I wanted to highlight what was new and something that I could demonstrate readily, and that's a very common component of my practice, but also something that perhaps patients don't know about. And so the first procedure that I will be demonstrating and performing is a product called Volbella, which is a hyaluronic acid filler. It has been on the market for some time now, but it has a new indication that was approved by the FDA for filling the infraorbital hollows, which is the area underneath the eyelid, lower eyelid, where the loss of volume either over time or that's just present in a hereditary fashion can be resolved with the addition of this product. So I'll be demonstrating that as a innovative new technique that we have at our disposal. So today's patient has typical features of lower eyelid hollowing, shown as here as shadows, where he's really lost volume and he may never have had it. Is this hereditary for you? Do you know other members of the family?
Maybe my father.
Okay. Either way, it doesn't really matter other than relying on our physical assessment of why this hollowing occurs. And that is because there's been loss of volume. One of the benefits of having so many tools at our disposal is that we understand how not only this anatomy develops, but also what we can use to treat it. And the newest indication is the use of Volbella, which is a hyaluronic acid filler that has recently received approval for filling this infraorbital hollow, as we call it. Some people call it the tear trough deformity. Either way, it's really the hollowing of this part of the lower eyelid, which causes a fatigued look in most patients that doesn't represent really how they feel. Now, at this point, we have to recognize that the contribution of the upper cheek, which in men is much flatter on the average than in females. And so with the loss of volume in this area, the lower eyelid loses its support. So we have recognized that the restoration of the volume to the upper cheek is just as important as filling the lower eyelid or the infraorbital hollows. So once the consent is obtained, the physical exam is performed. The next step in the procedure is to, in our office, is to clean the patient. And I use a combination of agents, typically alcohol and chlorhexidine. Every office may have a different approach. However, I'm pretty meticulous when it comes to fillers because these are biologic agents. The more fillers we use in patients, the longer they last and the more likelihood of having an adverse reaction. Now, I make sure I don't get close to the patient. There's certainly other precautions to take to make sure that the patient doesn't have a history of medical problems that could interfere or put him or her at higher risk profiles, medications, history of other side effects, etc. For the next component of the procedure, I like to use a topical numbing cream, which is typically in our office a 4% lidocaine cream that is placed onto the areas of targeted injection. It just tends to take the edge off the needle stick. It doesn't make it completely numb, and it also allows us to have sufficient amount of time to prepare the products for the patient. It is my preference to also give patients who are candidates an additional supplement, which is called Arnica. It's a homeopathic supplement, and I give this product to them to take at the time of the numbing cream for a 24-hour supply. So you take the first tablet now and one tablet every 6 hours for the 24 hours. It helps with bruising and swelling. This is the first tablet, and then these are the next ones. Okay, so I'll let you take that.
Thank you.
So the You're welcome. So the patient sits until the numbing cream has taken effect. Now I'm going to wipe off the numbing cream that's been sitting for a few minutes. Leave the other side for injecting later. And again, this is alcohol with Hibiclens. We're going to use two different products as we discussed. First, to treat the upper part of the medial cheek or the central part of the cheek that has volume loss, which is deepening the tear trough, and then doing the tear trough itself. The first product we're going to use is on label for the FDA to restore this region. It's called Juvederm Volbella. The product we'll use for the actual tear troughs is called Juvederm Volbella. That's the product that was more recently approved for that indication of the infraorbital hollows. Okay, very good. So the way I like to inject these patients is upright because it really gives the anatomy a chance to demonstrate itself. Eyes open and looking straight up to the ceiling. That way the patient is not worried about the needle, but looking up to the ceiling really allows an intensification of that inferior lower eyelid hollowing. Now I'm gently placing the product and targeting the area of volume loss. I'm going to ask him to breathe. Just like any new patient, he's probably more nervous than usual, and breathing does help. It's also important to advise patients that they should make sure that they eat prior to having a procedure so that they're not hypoglycemic. You doing okay?
Mm-hmm.
Keep breathing. And as you can see, we're starting to fill out this area that was previously hollow. Perfect. Now, we've restored the platform on which the lower eyelid sits. By restoring that platform, we're now able to treat the lower eyelid and give it the proper volume without making the error of overfilling it without having restored that platform. So, like most patients, he has loss of volume in the medial aspect, the central aspect, which is the area that we've already filled a little bit with voluma, as well as the lateral aspect. Now we're going to start with the medial aspect, little pinch. This is voluma. This is on top of the voluma, which was used to fill the cheek area. Now we're going in the inferior orbital rim. Little tiny injections. This is a very small needle. It allows us to have great control over the amount that we place into the areas. Breathe. You're good. Okay. And relax. And you really have to push hard to get this product out because the needle is very, very small. It's 32 gauge, which is wonderful from a pain and bruising standpoint.
Yes, it is.
The products, both the Voluma and the Volbella, like most of the fillers we have lidocaine mixed with them. That means that the pain continues to get better as the injection goes on, because as the product is injected, it also delivers a small amount of lidocaine. Now I'm starting to do the lateral part. Since I have done the medial part to the midline, I'm starting to work from lateral to the midline. And notice I'm not injecting a lot of product, just a small amount, because the eye can swell a lot, and so it's better to err on the side of under-treating and having the patient come back to do a little bit more correction than to over-treat and have a lot of product in there that may require dissolution. So if you can see here, now I've done this part, it's much smoother, the transition from here to here as compared to this side. And then this is the area that remains to be treated as compared to this area which has been treated, this area that has been treated, and here's the last little remnant. And again, this is injected deeply. I am on bone, and that's the safest place to inject. There are no blood vessels of any significant size in that region typically, and so we know that that's the best place to position our product. It's very important to know not only the anatomy, but also how to achieve placement of the product in the correct plane. Okay. Much, much better. Now that I've got a little bit of the product left, I'm looking to see which areas remain deficient, if any. You doing okay?
Mm-hmm.
Almost done with this side. And I'm going to take off this cream so that we can see the difference from one side to the next. And you can see a marked improvement in this area, chin down, where you can see this transition point has been improved. Look straight up. And the hollowing and the shadowing is severely diminished with a very natural look. Now, because hyaluronic acid products naturally are waterphilic or hydrophilic, this result is actually going to be even better tomorrow because the product will continue to absorb water over the course of the next 24 hours or so. And that's another reason why you don't want to overtreat. Beautiful. At this point, now that the patient has been injected, I allow him to ice, and we will continue on the other side. This side happens to be treated, so you can see he has a nice gentle curve of his cheek. You don't want to feminize the men unless that's their goal. I don't believe that it's his, is it, Allison? And so we also have the infraorbital hollows. So he achieved 1 cc of voluma here, and we did 1 cc of Volbella into the infraorbital hollow. So we will do the same on the other side. I'll have you turn, and the lighting is not terrific here, but we will treat the voluma here where he's lost volume and then move on to the infraorbital hollows. We're going to start with the voluma, which is this product, and I am hitting, breathe, the zygoma and the superficial fat pads, and I will walk my way across, breathe, and restore those areas of volume loss. And why am I doing this first, breathe, is because this really serves as the platform for the lower eyelid. If I don't restore this first, the loss of volume in this region is just going to pull down the eyelid because it doesn't have the platform, the support structure, the foundation. At some point in certain patients, if you do this reconstitution of the malar or the cheek, you may be able to not even inject the infraorbital hollow because you've effaced it by this treatment alone. One little spot. You okay?
Mm-hmm.
And this I'm delivering in what we call a bolus delivery, so I can place a reasonable amount of product in one area because I'm using it almost as a, basically as a foundation for lifting the cheek and popping it out. So I'm delivering this product deep, right on periosteum, which means the superficial part of the bone. And I'm watching the tissues respond to it. So I'm watching the tissues elevate off that part of the face. So now that we've restored that platform, we're going to move to the infraorbital hollows. You okay?
Mm-hmm.
Now this is the Volbella. Notice that it's pink. It wasn't made pink for the tear troughs. It was made pink for the lips, for which it was first approved. And this is a very soft product. It's much softer and thinner, chin down, and look straight up to the ceiling. And I asked them to do that because it really accentuates the hollow. And here I am, right on bone, in the medial aspect of the tear trough. And the end of the needle is right on bone. And what I'm doing is injecting. As I inject, I'm watching the tissues respond. You okay?
Mm-hmm.
And the tear trough, or the infraorbital hollow, goes from here all the way to here. So our patient today does have the characteristics consistent tear trough hollowing all the way across. But some patients may only have this aspect that's hollow. Some patients may only have the lateral aspect that's hollow. But very rarely do they just have the central aspect. So it's either this area or this area. He's fortunate enough to have all three. And this is a very small needle that comes with this product because the product is so fine. Breathe. You okay?
Mm-hmm.
Keep breathing. And in this region, because there's so little animation or muscular activity, these products are able to have a long span of duration. So whereas treating the region around the mouth here with this same filler may only last a few months, here it may last a year or more. You just don't have the metabolic activity of an area where you have a lot of motion. Breathe. Good. You okay?
Mm-hmm.
So the other thing you have to tell patients is because you're inadvertently always going to hit a little blood vessel. And so a little bit of lidocaine may go into that bloodstream, which may affect their blinking reflex. So if they blink funny, that's normal, and it will go away in a little bit. You also don't want to over-inject this region because the product is hydrophilic. So it will absorb water, and the lower eyelid is among the thinnest skin in the body, and it will respond to swelling very aggressively. So you don't want to overdo the product. You want to let it settle for a couple of weeks and then bring them back to see if they need more. Okay, very good. The lower eyelid is also one that is fraught with vasculature that's connected all the way around, and I wasn't going to mention it with the exception of if somebody's watching this video and I don't discuss it, I don't want them to think that this is an easy injection with no risk factors. So these blood vessels that are all here do connect to the ones to the central retina. So you inadvertently inject here, you can cause blindness in a patient. So you need to know your anatomy and you need to know what to look for. You need to have an emergency kit in the back, and you need to have your best friend, the oculoplastic surgeon, who can open up the eye and release any problem in that unlikely event. I think that if you know the anatomy and you know what to look for and you have all those tools, that's your best chance of preventing any complications. Questions? How do you feel?
Good.
Okay.
Yeah.
Well, thank you.
Thank
I
you.
will let you do some ice.
Okay.
You have your arnica.
Yes.
Perfect.